In this educational series, we are going to talk about the human papillomavirus, otherwise known as HPV. We are going to talk about some of the signs and symptoms of HPV. We are going to talk about treatments for HPV, prevention methods for HPV, and we're also going to talk about common myths associated with HPV. Human papillomavirus is one of the most common sexually transmitted infections. Nearly all sexually active men and women are thought to contract HPV at some point in their lives. There are over 100 strains of HPV. Research shows that there are 8 strains that cause 90% of cervical cancer globally. HPV is spread through oral, anal, and vaginal sex with an infected person. Currently, there is no test or cure for HPV. There are treatments for the health problems associated with HPV, such as screenings for cervical cancer in women. Most people find out they have HPV when warts appear, or in women when there are abnormal Pap test results. In most cases, HPV goes away without any intervention. The CDC estimates annually in the U.S. there are 360,000 people who have active genital warts. There are 11,000 women who will be diagnosed with cervical cancer. And there are 14 million new HPV cases. You may be wondering what you can do to help prevent HPV. One of the ways that you can help prevent HPV is to get vaccinated. Vaccinations are offered at the UTEP Student Health Center to male and female students under the age of 27. Most private insurances will cover the cost of the vaccine. Non-insured students can take advantage of the Patient Assistance Program to lower the cost of the vaccine. See the UTEP Student Health Center pharmacist for more information. Another method to help prevent HPV is to use protection. Use protection for each sexual encounter. Proper use of condoms or dental dams will reduce your risk of contracting HPV and other STIs. The CDC recommends that both males and females under age 27 get the HPV vaccine. On the following chart, it shows the ages and recommendations from the CDC. HPV generally has 0 symptoms. It's hard to know if you or your partner are infected. Stay safe, get vaccinated, and get tested regularly for STIs. So we are now going to talk about some common myths that are associated with HPV. Only women can get HPV. The fact is, men can get HPV as well. The CDC states that most sexually active men and women will have at least one HPV infection at some point in their life. Any person who is sexually active can contract HPV regardless of the number of sexual partners. All strains of HPV cause cancer. The fact is, not all HPV strains cause cancer. There are over 100 strains of HPV. Some strains of HPV can cause anal, cervical, penile, and vaginal cancer. High-risk strains, like strains 16 and 18, can cause cervical cancer and account for 70% of cervical cancer cases. Low-risk strains of HPV do not cause cancer, but may cause anal or genital warts. A very common myth is if you don't have sex, you won't get HPV. The fact is, HPV is spread through skin-to-skin contact, including anal, oral, or vaginal sex. Proper condom use may lower your risk of contracting HPV. Treatment options are available for HPV. The fact is, there are treatments for the health problems caused by HPV, such as genital warts, or precancerous lesions. There is no treatment for the virus itself. HPV always has symptoms. The fact is, HPV generally has no symptoms. There are health conditions associated with HPV, such as genital warts and cervical cancer. A common myth is, I got the vaccination, so I do not need routine pap tests. The fact is, the HPV vaccine will not take the place of cervical screenings. The 3-part vaccine series is a preventative measure and will not help someone who has already been exposed or infected with the HPV virus. An abnormal pap result means cancer. The fact is, an abnormal pap test result can be caused by factors other than HPV. When a pap comes back abnormal, additional testing is done to evaluate the abnormality. Your healthcare provider will explain the process in detail should you have an abnormal pap test result. The HPV vaccine may cause dangerous medical problems. The fact is, the HPV vaccine is safe and effective. It does not contribute to health issues. As with any vaccine, there may be mild reactions. The most common reaction is soreness or redness at the injection site. HPV can be cured. The fact is, viruses cannot be cured. HPV can lay dormant in your body for a long time and reoccur frequently. It is always best to use safe sex precautions and get regular pap tests. And just a reminder, the HPV vaccine is available at the UTEP Student Health Center. This vaccine is free for students with most PPO insurances. There is the Patient Assistance Program, which is based on financial need. It takes about 30 minutes for an approval or denial, and it costs $20 per shot for non-insured students who participate in the program. See the UTEP pharmacist for more information.